All right, here we go. Today we are going to do MRCP. We're gonna look at the common bile duct. And once again, whatever is in bold needs to be filled out with something, anything you want. Exam. Basic. MRCP. And close this. All right. Look at all these protocols. All right. We're just going to do the first one. So remember to bring the whole card. If you want the whole thing, all you got to do is click on the program or protocol and hit this arrow. And there you have it. If it bothers you to highlight and delete what you don't want from the card, then what you can do is click on whichever ones you want. Click one and then hit control and just click whatever you want. Once you're done with that, you hit this gentleman right here, the arrows, and it'll drag onto your scan. All right. So we got one localizer. Now we're going to do another one. This other one is going to be a breath hold, okay? Just everything in the middle. Make sure you get everything in the abdomen here and apply. Alright, so this one we're going to start because we have to instruct the patient to hold their breath. Alright, go ahead and hold your breath. Breathe. Alright, so all these, breathe. So all these here is the same setup as the abdomen without. So since we have volunteer, we're not gonna set them up. Except these. Okay. This one here, okay, it's a thick slice. Let me cancel that. I want to show you what that says. This one here is a thick slice of the common bile duct, okay? This is telling you that you can only select 4 coils, okay? It's telling you which are selected, okay? So if you don't like the ones the system selected for you, I like my body coil to be selected, SP3 and SP4. But you see how I deleted one of them? Alright. So these 4 is the ones I like, okay? Maybe we can do this one and this one better. There you go. And the body. Alright. This here is going to take a nice, big, thick slice of the common bile duct. Okay? That looks pretty good. Hit apply. And you see how there's 3? What we're gonna do is we're gonna right click on the top one, copy parameter, and then center of slice and slab groups. Okay, hit OK. And the thing with this, we're not gonna do all 3 because they're all gonna be the same. So what we're gonna do on the next one is we're gonna angle Okay. And make sure you put it on the common bile duct. Unfortunately, we don't have a good picture here. Hit apply. And then the next one, so you remember which way you went the first time. I mean, this, see, now we're gonna go the opposite way. Okay. I'm just guessing where the common bile duct is, but you should see it around here somewhere. All right, I'll apply. All right. Hold your breath. Breathe. Let's see how good my x-ray vision is. Ooh, look at that. Perfect. Hold your breath. Breathe. All right. Hold your breath. And breathe. All right. So this next one, you're gonna bring your first localizer on these two planes, okay? Then, we should have done one axial. And for this one, you can select as many coils as you want, okay? So, what you wanna do here is we just want to cover where the common bile duct is. Okay, put this straight here. Okay. So this first one here, you're gonna look at your coronal and you're gonna see the highest image where your liver is higher. I don't know if I said that right. So you see how I dropped? I will say this one. So this is the third one. Now you're gonna go on this one and you're gonna get the highest on the sagittal of your liver. All right, okay. Then this here, okay, this is your field of view. All right, you just want it above the liver, okay? Then you're gonna click on your trigger here. This here, you're gonna move it to the top of your liver. Now, the way I do it, you see this circle here? I like to have that circle on top of the liver, okay? Just put it on top. You can put it wherever you want, but I like it on top. All right, so you saw me move this around and you see how this sagittal is not solid. You see that on the sagittal? Okay, but if I move it, it turns sagittal. I mean, it turned solid. So now that this is solid, we want this one solid. So we're gonna move this one around and now both of them are solid. See that? Okay, and remember what I said? I like to put my ball on top of the liver. Okay, right there, and right there. Okay, now we gotta make sure we get this common bile duct here. I'm gonna guess around here somewhere. Okay, I think we're good. All right, and hit apply. So it's gonna take a picture every time she breathes out. So you see it's just taking a sample one here. So she took a breath, breathe out, breath, breathe out. Okay. All right. And you see these yellow ones? That's a picture that it took. And you'll hear the scanner make a noise. There you go. I don't know if you heard that. Now, if you want this scan to go a little bit faster, you have to tell the patient or instruct the patient before the exam just to breathe nice and normal. Okay? And it's going to take 178 pictures. We're barely at number 7. Okay? There's an estimated time. I don't know if you can see down here. We're at 11:22. But now she's starting to breathe way better. I don't know if you can see the change. Nice breathing here. Oh, spoke too soon. All right, we're gonna take a break here until we're done with this scan, okay? All right, so we're almost done with this MRCP, so I start the video again. Now, we're almost about a minute away. We're at 167 out of 178. I don't know if you can see that right here. She's been doing pretty good. Alright. So 9 more breaths. We should be good. So don't forget, if you want to know how to set these up, watch the abdomen without. Okay, same thing. Make sure you get the whole abdomen. You know, make sure when you're doing your coronal, your whole abdomen is in the field of view. 2 more. Alright, that is it. Did we get everything? Boom, look at that. So nice, so nice, so nice. So there it is. Alright, let's get this patient out. And I'll show you how to MIP, okay? I'll pause this here.